Sometimes career becomes the most important question for all of us. And to answer which is the right career, which is the wrong career, it's very difficult. Good evening. Welcome to Biotechnica. I'm your host and success coach, Shekhar Suman. My voice is a bit down today. Thankfully, I'm getting a Amitabh Bachchan's depth voice because of cough and cold. But don't worry, the specialist here, the expert here, is going to guide you on the career part. I'm here to tell you that today's trend, which has the potential to become tradition of the industry, must be embraced. And if I have to tell you in a concise way, biotechnologists can definitely make a glorious future in health sciences, health technology. Now, today we are here to talk about career prospects in molecular diagnostics with digital imaging. Before we pass on the controls to our experts and our host for the day, I have a few pointers for all of you. You should know that as a biotechnologist, you can pursue some skill development courses in this topic, and then you can be absorbed into the industry in AI, molecular digital diagnostic imaging, and companies like Illumina, Genentech are hiring for people like you. Now, you can become a molecular diagnostic technologist. You can become a digital imaging specialist with AI. You can also become a bioinformatics analyst with this knowledge. And you can also become a clinical laboratory scientist. But more than that, you can also become a research scientist. So you can see here, there are multitudes of opportunities for all of you. And this is a postgraduate diploma which Manipal Institute of Regenerative Medicine is conducting, where you can work as a student and then later on get absorbed in the industry. So without taking much of your time, I would like to invite Dr. Tanushree ma'am. She's going to be the host of today. I will not be able to host because of my bad voice, bad throat, I should say. And of course, we have our expert from Manipal Institute of Regenerative Medicine, Bangalore, Dr. Sangeeta Nath. So over to you, Tanushree ma'am. Thank you so much for joining. And hi, Sangeeta Nath ma'am. How are you?
I'm fine. Yeah, thank you for inviting me. Yeah.
Yeah. So over to you, Tanushree ma'am. Thank you.
Yeah. Thank you. Thank you so much, sir. Hello, ma'am. Very good evening.
Very good evening. Yeah, nice to see you, Tanushree.
Yeah, same here, ma'am. And good evening to all our attendees.
Yeah.
So I'm sure you all are very much excited to know about this very important field that is molecular diagnostics and digital imaging. And ma'am is with us, which will be answering all your questions related to career in this field and where are the courses, what are the courses, where you will find such courses, uh, so that you can pursue your career in this field. So, ma'am, as we all know that molecular diagnostics and digital imaging are two vital components of modern healthcare that contribute significantly to diagnosis, treatment, and management of various diseases. So, could you please provide an overview of how molecular diagnostics and digital imaging are revolutionizing healthcare?
Yeah. So actually, healthcare's industry is expanding, and it's now a huge industry. Earlier, all the pathologies detections, everyone was manually going, and now in the era of artificial intelligence and digitalizations, how you'll put the word actually. So people are more used to with the word artificial intelligence, and
Yes.
which is actually nothing is a digital approaches that actually in the diagnosis and molecular pathology that in the healthcare is coming up, and in clinical practice is it's not that only coming up, it's an essential part now. Otherwise it's very difficult to handle the huge data system that actually generating every day. And with the advancement of this technology based innovations and diagnostic approaches, so that actually replacing the conventional methods and diagnosis system. and that replacement is happening too fast. And not only in India, is a whole world need a huge manpower forces. Yeah,
Yes.
and that actually this industry is facing the problem of the specialized trained manpower, and which is not a single like only biotechnology based uh, training. This is a interdisciplinary training. Those we are trying to provide, because now Manipal Institute of Regenerative Medicine is a part of Manipal Academy of Higher Education, Bangalore campus, which is a big campus, and where we have a Manipal Institute of Technology department, and we have a huge advantage of Manipal Hospital, Kasturba Medical College, which is a research-based huge hospital, and also we have a bioinformatics department, Manipal School of Bioinformatics. So this interdisciplinary with all faculties, we wanted to provide this gap which is generating, and which actually will give in a coming years huge amount of jobs. And industries are trying these people, this kind of specialized people, but the problem is those know the artificial intelligence, they don't know the bio, and those know the biotechnology, the conventional method of detections, they don't have any idea of the how this digitalization is happening, and how this artificial intelligence are using in these techniques. Yeah, and how to handle these huge data systems. Yeah, and how to use this data system in the cloud, and these are not a very mm, difficult actually. Problem is people don't have the fundamental knowledge of that. So we want to connect all these things in a short course. It's not a like a 2 years masters, or you spend many years in bachelors. So we want those already knows either of the bio or of the AI, they come will uh, that complementary the other part will teach, and will make a package, so that industry needs that actually hugely coming. Yeah, so for a moment right now, uh, uh, this industry actually 1 million in India, in Indian market. Yeah, and it's that prediction, it will grow like a 8% from 2024 to 2030. But actually, frankly speaking, India doesn't have the capacity to uh, grow with the proper specialized manpower. So this is our initiative, and we want this kind of modernizations of the courses need to be introduced, especially if for universities like Mahe, where we have all kind of faculties, and that is our aim, uh, to give a specialized force which can replace the current growing industry need.
So I'm
Yeah.
really glad to hear, ma'am, that MIRM is taking such an initiative and coming up with such courses, because I completely agree with you that yes, with the incidence of diseases, uh, definitely a lot of data is generated, and definitely we don't have the manpower which can analyze such data, and even like there's a quick need of analysis of data, because based on that only the further treatment plans the doctors can advise, and the drugs can be developed, because now we are moving over to the precision medicine also.
Yeah.
So I would like to know, like as you mentioned about a course, so like obviously if a manpower is needed, so some skills must be needed from this manpower, right? Like some diploma courses or degree courses, like those who wants to make a career in this field, definitely they need to do some graduation, post graduation or diploma courses in this field. So could you throw some light on how one can make career in this field? Like is there any institute, or like as you mentioned about MIRM, what courses are being offered that the aspiring candidates can take up to make a career in this field?
Uh, Actually, any BSc, even the MScs, actually, those after doing MSc is bit confused what they will do, because after doing the traditional MSc courses in genetics, microbiology, and many are sitting in, actually, they are not in the specialized streams. Yeah, there are in bioscience, there are a lot of uh, streams. Yeah, biochemistry, biophysics. Yeah, and when they approach for the industry, the modern industry is actually looking for different modules nowadays. Yeah, even if you go for uh, that bioinformatics related analysis, or so modern industries are using lot of that uh, artificial intelligence based lot of modules for faster introductions of the products. They have to compete with the world. Yeah, so when they are going to give the interview or thing, they cannot match actually what industry are doing and what they learned in their MSc courses or in their BSc courses. Yeah. So I think these confused phases, those are sitting, they can come and quickly do 1 year. They don't have to spend 2 years or 4 years of graduations, or 2 years of masters, then a huge research-based project. So they can quickly come and can understand how actually to integrate the different systems to work in an industry. So and especially that those are pathology, in pathology lab, lot of technicians actually they hire, and they're not much well paid, because in that hospital need to train them, even industry need to train them. So beginning few years they are really very less paid because they don't have these experiences. Yeah. So those kind of people, without going to immediate going to low paid industry job, they can take this training for 1 year, and then they can go to this industry, and they will be in a better job positions and better secure, and the industry will really like them to use, because they have the prior knowledge, and at least they know how to integrate all these systems that actually practically you need in an industry. So those actually will help. Even the pathologists can come. Many pathologists, those want to uh, give the research aspect, means how to pathological data uh, to make a quick diagnostics. That actually big industry, and if you can make a quick diagnostic with just adding the AI module, like for example, actually earlier that some nerve diseases, I am saying very layman language. Yeah. So the measuring the only the nerve diameter, you can tell what kind of disease it is. But measurement of the nerve diameter in different places, yeah, it's a huge data generated from a single patient. And then how that data will diagnose that the person has the disease or not. Yeah, that you can make a pattern. Yeah, and from the data you just put in the that pattern based, what is called that machine learning. Yeah, machine learning, or uh, that artificial intelligence, you can tell deep learning, machine learning, that is nothing, that a huge data, where from the data you will make a pattern. Yeah, and this pattern, any specialized doctor who knows what pattern comes, but they don't know how to analyze this pattern, they, and those are really brilliant students those can understand how the nerve diameter would be. If you give a little bit of basics of them, they can actually make that diagnosis like a what right now the industry wants, the quick diagnosis. Yeah, so you can train them, and they can come and quickly they devise different kind of advanced diagnostic module, actually that developed in the Astra one doctor actually developed. Yeah, and they worked with us actually. And this nothing actually, that images of the nerve and from the pattern they told, and the then whole package of AI have given. Now in a 1 minute they can actually mm, mm, complete nerve, actually they can diagnose and store, and then can tell the patient has the disease or not, and that they are trying to sell in a huge amount in the market. So those want this kind of uh, uh, that they are specialized pathological training to autonomize or digitalize and sell as a product that is will give a, like a domain of a research domain, new research domain which is coming up, AI-based diagnostic. And it's in abroad is a huge field. And India also is coming up and people are trying. Like Indian Institute of Science also started 6 month specialized course. Only few students they take, so they cannot make a huge number of students. But Mahe, we have a capacity to take and make a generalized huge course. Yeah. So we wanted to, as a private university, wanted to contribute and start as a modernized course, which India needs. At least Mahe thinks. Yeah.
No, ma'am, it's a really good thought. And definitely, like most of the postgraduates, like once they have done post graduation and looking for the job, so definitely this small diploma course will definitely going to help them, especially if they are uh, looking to make a career in field of healthcare.
Yeah.
And especially as you mentioned, ma'am, about experience. So most of our subscribers and students, they often ask us, like they have the courses, they have done the courses, and like they have the degrees, but the biggest problem is like when they apply for the job, they ask for experience. So my next question is like, do MIRM collaborate with any kind of healthcare institutions or industry partners for research and training? So this experience that the students they get through this
Yes.
course, so maybe it will be like it will help them in later in applying for the
Yes.
jobs.
Yes. So actually, the end of 4 to 6 months, we first keep the group projects. Yeah, that will help to learn those don't know the coding at all. Yeah, for them that R or Python basic language courses. And then another 4 months, 3 months, they can choose the industries. And we have actually the scientists from Philips actually will teach the course, and they will give their images, MRI images, and how to analyze. And also Kasturba Medical College, KMC Mahe, their pathologist will give us complete their sets here, and their practical oriented analysis that actually we also included in the course, and that as a project they can go and by hand they can do. So and last 4 months we'll send to different, even in different microscopy companies, like we have already talked here. So and we'll send like a Philips and also the flow cytometer companies, those do that image based analysis. Now actually different hospital does this millions of cells with a flow cytometer and analyze their cells. Yeah. So these flow cytometer companies also will collaborate with us, and will send in this industries actually last 4 months. And if some student personally want to go some companies and they choose that companies, we'll also make that MOU with them and we'll send them. So we want actually industry based and by hand experience. It's not theoretical experience. So exactly how the medical images people analyze, uh, and
So
our
hands-on
monitor
experience.
hands-on experience, and our
Yeah.
monitor instead of technology, uh, they will teach that programming, machine learning, deep learning. This is not that MIRM faculties will teach. We'll just teach, MIRM faculties will teach the biology-based diagnosis techniques, that the core of biology, that essential for diagnosis, because fundamental of the diagnosis is the you have to go to cells and identify one part of the
Yeah.
cells or one part of the tissue. That actually we MIRN faculties will teach. And then we'll this module is a interdisciplinary, and it's a collaborations collaborative course with Manipal Institute of Technology and Manipal School of Bioinformatics. Yeah.
So it's really
So
great to know,
all
ma'am, that
faculties. Yeah.
yeah, it's really
Yeah.
great to know that along with the theoretical sessions and modules, we have the students will get the hands-on experience, because this is what actually the students they look for. The those who want to make a career in this field, they look for. So it's really good to know that through all your collaborations, students will be those who will be associated with this module will be benefited through these collaborations and hands-on experience. Now, ma'am, as you talked about cells, right? So I just wanted to know, like nowadays, even there's a lot of career opportunities in stem cells also, right?
Yeah.
We get a lot of questions from our subscribers and the CSNet aspirants and our students who want to make a career in field of cancer biology and stem cell research. So could you throw some light on this as well? Like, do you have any kind of opportunities for those who want to make a career in this field as well?
Yes, definitely. That diagnosis of the cancer biology is completely basis of that fraction of cells which is abnormal. Yeah, that also depend on the markers. Even the stem cells, cancer stem cells, which actually stay within the tumor populations, and which is sometimes good actually, but sometimes it's just erupt and make the metastasis and the suddenly eruptions of the cancer. So that also have a specific characteristics. Yeah, that and for that you need a specialized expert to know that. Maybe in a layman language, if I tell, I think audience don't know the science so much. So in a layman language, if you tell like in a million of cells, maybe mm, only thousands of cells are in a specific characteristics, and for that you need to know what is making that characteristic. Some kind of marker, some kind of protein, or some kind of RNA, or some kind of DNA is damaged there. It's not the normal, abnormal, and for that you need to make them colored or something. Means we have a technique how to specifically identify that with this colored antibody, or with the fluorescently color some protein. Yeah, or some in situ hybridizations, some fluorescence will come. Those actually are technique. Yeah. So and we specialists, those are specialists who know in that system what kind of stem cells can stay, so that will mark. Yeah, so that actually in a millions of cells, only few cells are like that, and that actually erupt and make some diseases. Then how do you diagnose? Means you have to like a millions manually you cannot do. Yeah, so there should be some automatic diagnosis system. There is flow based system, but that also not fully automated. That actually in research level, a few tubes you can go. Yeah, but when it's coming to the patient, it's thousands of patients, and from one patient, millions of cells. So you can understand the size of the data. That actually over the time is increasing. Yeah. So even if we traditional biologists, we think no, we need to know the basics how cells look like in a thousands of cells, two cells look like. Yeah. But actually, practically, you have to. Um, uh, increase the you have to understand the practically what is the size of the data when real patient come. Yeah, so then this method have to implement. So here you need the knowledge of stem cells, you need the knowledge of cancer biology, and cancer diagnostics actually is a huge amount of effort is going for artificial intelligence based diagnosis. Otherwise it's day by day it is becoming very difficult. Number of patient is increasing, knowledge is increasing, uh, data is increasing, and hospitals are really facing huge problem because they have to make automation. Otherwise, manually it is not possible.
Yes, ma'am, absolutely
I
correct.
hope I can connect the how things are connected. Yeah.
Yes, ma'am, definitely, definitely. So even we have some viewers and they have the questions which we'll be taking after some time. Now, ma'am, you mentioned about the course and you mentioned about like you provide some insights on this diagnostics and digital imaging, artificial intelligence also. So like I would like to know is like, do you have any, like would you like to share some success stories of your MIRM graduates who have made significant contributions to health science through this digital imaging, AI, or molecular diagnostics? Because this will definitely encourage our viewers on
Yeah.
this particular digital
So,
imaging, or to make a career in this particular field.
so our MIRM has a huge success story. So if I go for alumni, even I can't track actually so many ex-student come and tell I am sitting in Cambridge, I am sitting in Harvard. This kind of stories actually. Without data, I don't know if I tell how people will believe. But even if you forget about the abroad, if you go to this national institute within the Bangalore, if you go that ISC and CBSC, our students are highly actually yeah, regarded, and they are really like to take them as a researchers. And not only that, in industry also huge amounts are going in Syngene Biocon. You can go and you can see, yeah, it's a huge number. They are, yeah. So in that sense, I will say actually our one two student actually went for cancer stem cell biology, and they are really doing this kind of research actually in abroad, one in Germany, I know. And so how this diagnosis can be done on that they are doing. So I can specifically tell these things, yeah. And also, as this is the emerging upcoming field, I think once we start this and this expertise our students get, the numbers will increase hugely, because that world need this kind of specialist people. In the 10 years, the diagnosis system in healthcare will change. Clinical approaches will change. It has to be changed. Otherwise, it is very difficult to manage. Manually, the traditional way healthcare was doing. Yeah. I think it's already started changing.
Yes, ma'am.
Yes.
And there are a lot of recent advancements also. So,
Hmm.
is there you talked about your module? So, do you include the recent advancements also in your curriculum, in your module, if
Yes, yes, sir.
anybody
Yeah.
is interested in?
Especially the recent advancement from Philips, actually, we have completely separate module. They are just doing, and also from our engineering department, actually, they also show how that not only the image based, also that how the different kind of microscopy you can develop to take quick images in the from the rural area, where you don't. Uh, give the huge facility. From there, how quickly you can take different kind of blood sample and quick diagnostic, even the diagnostic image-based diagnostic, mobile diagnostic also they are trying, and that data they are generating as a digital based and module in the cloud in the AI. So those kind of things we will give we have included. We have those kind of expert faculties actually. And in Philips, all MRI, and we have a special module where you can really understand how uh, MRI actually diagnosis is happening, and how that AI desperately need to uh, that speeding up that diagnosis. So, and they have a huge research unit, and that they will also try to give how this research actually flourishing in this course. Yeah.
Thank you, ma'am. I request all the viewers, if they have any questions related to digital imaging or healthcare, they can post their questions in the chat. I'll take up your questions after some time. So please post your questions in the chat, and it will be taken after some time. Ma'am, I would also like to know that even now we are talking about personalized medicine, right? Personalized medicine
Yeah.
and
Yeah.
patient care. So how are advancements in molecular diagnostics and digital imaging, they contribute to personalized medicine and patient care? And even like when we talk about addressing global health challenges like pandemics or chronic diseases, so what is the impact on what is the role of these technologies in addressing these global
Yes.
health
Yeah.
challenges as well?
So actually, this is even we give the name of digital imaging, but this course will help you to understand how the digitalized or artificial intelligence you will use to manage the data. And in COVID, we saw actually this is a like a huge data, yeah, and how actually we handle it was huge, difficult, but uh, somehow people manage, yeah. Even there was lot of drawbacks. We did not any training earlier. So initially, really we suffered. Not only India, whole world actually suffered to
Yeah.
quick diagnostic and that data to provide everyone to do diagnosis. Yeah. And in that sense, if you see the precision medicine, how it will come about the your data, means your blood sample data, your genetic data, all analysis will be stored in a digitally in a cloud. Yeah. And when some disease will come, you will match actually exactly what uh, for what reason you are getting this, exactly for which gene or for which protein abnormality you are getting. So precisely it is patient to patient, it will vary and it will come and treatment will happen. So that actually it's a complete. If you don't have this huge data about you, we cannot go for a suddenly for a patient precision medicine. First you need the data to generate, and so that is one of the challenge, yeah. And also there is another challenge is the privacy of the patient precision
Yeah.
medicines before going, yeah. So we cannot disclose actually. If someone has a blood cancer, they cannot give data to public, because
Yeah.
then insurance company will not give them insurance. So there are a lot of problems in that. So even data handling and the privacy issue, yeah, that also we kept one of the module that our Manipal Institute of School of Bioinformatics, our expert will teach. That is very important, yeah. So all these things you need to know before going to industry. And industry wants the people should have some kind of prior knowledge. Otherwise, the kind of those are doing the traditional biology courses, yeah, biochemistry, microbiology, and when they are searching for jobs, they either they want huge research experience, PhDs, yeah, because
Yes,
during PhD you will get the different kind of perspectives, yeah. So that is actually 4 5. If I tell four
ma'am.
5 years, it is lesser. Minimum five
Yeah.
6 years or 7 years you need. Otherwise, it's very difficult. People are facing to get immediately after graduation or immediately after MSc the jobs. Yeah. So those perspective actually is very important to learn. Yeah. So we think in a 1 year we will try to give the whole package. Yeah. So then student in the last 3 4 years of the course, they can go in the industry they want, they like. Yeah. And they can do an intern, yeah. And we'll make arrangement of the intern if someone is really specialized for going to precision medicine. So some hospitals, some really want for MRI data so with Philips, or someone that pathological images with the multiple hospitals. So we will as per the student, we will give the opportunity for the last 4 months, yeah. Mm. So all actually comes as a artificial intelligence, you can tell, which is a more catchy word, but actually it's nothing. It's like a huge data to manage by machine learning. Machine learning, if you say in a layman language, it's nothing. It's like a huge data how you cannot manually read, how machine will read, and how machine will make a pattern from that. What actually Chat GPT is using. Yeah,
Mm.
they have a huge data of the literature. So when you are searching, they know the pattern, what exactly need. From the search word, they just quickly picking up that, yeah, picking up that and giving you that. But for medical industry, that is not so straightforward because for the privacy that I told,
Yeah.
yeah. So you cannot disclose everyone data in the like a literature data like ChatGPT. So that also learning actually. So industry how works in the medical. So precision medicine, even we are talking lot, but there are a lot of things actually you should understand. Yeah, because yeah, if maybe insurance company will be very happy if we are give disclose our data. Then they will charge as per your abnormality in your gene. Yeah, so but that's not the thing. Yeah, if you have some kind of disease you acquired, so insurance company cannot tell I will not give you insurance. You have this defect in this gene. So we have to think in a bigger picture how this precision medicine will come, how healthcare data we can handle. Healthcare data is much more sensitive. Even you know AI, even you know uh, uh, that machine learning, even you know all these softwares, all this coding, but medical data is completely different.
Yes,
You
ma'am.
have to be very sensitive about that. Also, one of the thing I think our course can give.
So indeed, ma'am, data security is very much needed. Uh, it is like definitely, and even when we are talking about AI, as you mentioned, like we are using AI in our everyday life. But you are right that when we are applying AI, especially for management of healthcare data, then definitely the security, data security is the must. Now,
Yeah.
ma'am, many of our students, we provide, like many of our CSR net aspirants, they have qualified CSR net and CSR net December 2023, and many of them are interested in pursue their career in research field. So I would like to know, like, can you elaborate on research opportunities which are available to our students, especially in cutting edge areas like AI applications and digital imaging or new molecular diagnostic techniques?
Yes, actually, huge are coming up. Even I that I told in uh, Manipal KMC, they do this kind of research. Yeah, in pathology department, even School of Bioinformatics, which actually which co-coordinator of the course. And Bangalore campus, we are coming up of this all these things. Yeah, Bangalore campus is new campus only that. Uh, 2 years, so I cannot tell everything is in the Bangalore campus. We are growing, yeah. So we want the Bangalore campus to be more modernized and with the modern courses, yeah. And it's coming up as we have the Manipal campus, the Udupi Manipal campus, and where we have all kind of this work is going on. It's a pathology in the Kaustubha Medical College, the KMC Manipal. They have huge of this research is going on how the pathological samples to be diagnosed, have to be autonomized, and in Manipal hospitals they use a lot of those things. Yeah, so these are going on. This is not that it's already started for years, but the thing is majority comes after the research because this is highly specialized. Till now, whoever comes, this is they take as a major research project. That I gave one example how nerve diameter you can
Yeah.
autonomize and quickly diagnose the diseases. Yeah. So those actually coming there either very specialized doctor have a huge interest on AI. They learn by themselves. Yeah, those all those actually came in the industry. I know they haven't done any formal courses till now. They all are coming by their own. I means they are very much interested. They want to do, say they run here and there to learn the programming, what is AI, what is machine learning. As a doctor, as a pathologist, they ran here and there and they made this. Yeah, but this is not time that individually one two people will do this because we need to emerge very quickly. So these courses actually need, because individual people cannot develop this. So these courses will make more focus on how this can be in the research level. They can understand, they can go, and they can also, if someone don't want to go for research, they can go for quickly for industry. And in till now, industry also, if you go GE, Philips, they all actually very highly learned person. Those are working on this. Yeah, so and now they want manpower, those can support them, uh, and but they are not getting because it's an
Yeah.
interdisciplinary field. that problem is already started, and they don't know how to generate this manpower. So that is the biggest challenge. So hopefully we are starting this, and maybe over the time uh, it will grow, and also over the time we can understand needs and modify questions will
Yes,
go. But we have
definitely.
already all these things in the Manipal Mahe campus, and in Bangalore campus we have all this machine learning, all experts. So it will be very easy to start this module from MIRM, we thought. And we want in the Bangalore campus, so we can access all these industries those are in the Bangalore.
It's really good for the freshers, ma'am, who are looking for the job opportunities and for like want to do some diploma courses so that they can enter into the industries or into the research. So it's really good for the freshers, especially.
Yeah.
So, ma'am, you have provided a lot of insights on diagnostics, molecular diagnostics, and digital imaging in healthcare. So I would like to know what advice would you like to give to the students who are interested in pursuing their career in health science, particularly in AI, molecular diagnostics, and digital imaging?
Yes, I will give insight to them. Like even I know many people from biology, they just quickly learn languages to go to IT industries. Uh, I would tell them, yeah, don't go IT industry, because sometimes people think IT industry pay more. But in your
Mm.
field also, actually, AI is very much important, and which can give big opportunities. You just have to learn some languages that is not much tougher. Sometimes bioscience students think it's very tougher, they cannot learn. And but it's not tougher. If we teach, it's a very simple actually. Learning of languages, machine learning. I told is this is nothing like making up patterns. Yeah, with some coding. Yeah, if you know what exactly you want to look, what is the pattern, and if database is there, yeah, so you have to make the database generation. So this is actually simple, but people think the thing is the barrier between the different fields. So people can't understand what actually the things are. So for them, I will tell that don't be scared that there is a machine learning terming, there is a programming language. So these are not tough, and if you come, it will open up a huge field and huge diversity, and they can later choose maybe the other directions in their career. Don't yeah. So it will open up the uh, full overview of the healthcare system, how it's going on. Yeah, from the particular research to automations and AI. So I think it's a very important step, student to actually uh, come and learn. Yeah, instead of
Yeah.
fearing. I feel some actually have a barrier, this interdisciplinary things. That should go away. It's not tough. People can learn actually.
So, dear
So
viewers, you have heard, ma'am. It's not
yeah,
difficult. Everyone can do it. All you need to do is be ready to learn new things and
yeah.
uh, aware of the new opportunities. And here at Biotechnica, we always come up with these kind of sessions so that you all can know about what is upcoming, and what all courses can help you, can benefit you in making your career in field of healthcare and other fields, other related fields. Now, I would like to take a few questions in our chat. Ma'am, we have few questions in our chat, so I would
Yes,
like to
yes,
take
yeah.
them. So we have a question from Swikriti. Very good evening, Swikriti. So you have a question that you want to know about what is the basic difference between microbiotech and medical biotech. So the attendee want to know that how which one can help her to achieve quick job placement. Like, is it medical biotech will be good for her or microbiotech?
So
Hmm.
that is actually uh, what I will tell. So in a technical term, if you tell micro when word is come, that is the some bacteria virus it's
Yeah.
there. But in medical actually also medical includes the bacteria virus. So medical is not uh, without that uh,
I think
microbiota.
more applied comes in medical biotech, ma'am, right? Medical
Medical biotech, yes.
application comes in medical
Application comes.
biotech.
Medical biotech, more application
Yeah,
comes. So,
application based. Yeah.
and when micro comes is with the microorganism based
Mhm.
comes mostly. So that is the different. You will be little specialized in microbiotech, but in medical, you will learn more things actually. Medical biotech. So there, not only the microorganism will be included, but other diseases, cancers, and those are irrespective of the micro. You can understand. Yeah, you will learn.
And moreover, ma'am, I feel like it all depends upon in which field they want to make a career, like in research or
Yes,
in
yes,
industry. So
yeah.
that also depends.
That's also depends, and
Yeah.
actually the fundamental learning I will not tell too different. Yeah, it's
Mm,
your
that's true.
learning capacity and how you can modify yourselves and go to the industry. All depends on that. Fundamental basics little bit more in medical biotech than
Yes.
microbiotech.
Thank you, ma'am. Shikriti, I hope this answers your question. I request all the attendees to post their questions in chat. If you have any questions related to AI, related to the courses in MRIM, MIRM, and any questions related to the healthcare, medical, molecular diagnostics, and imaging, imaging. So you can post your questions in the chat. We'll take up your questions. Miduna, you have a question that you would like to know the career after MSc biochemistry. So, ma'am, after MSc biochemistry, will this course be helpful to her, Miduna? Like if she joins,
Yes,
goes through
yes,
this course.
definitely. Yes, definitely. After biotech, yeah, biochemistry, if you are coming, it will really help because biochemistry is used in all kind of diagnosis. Yeah. So, and eh, especially the biochemistry is the basic of diagnosis. If you see the different method in the biochemistry we use, yeah. And with biochemistry, little bit if you push biophysics, then all this MRI, NMR, all everything comes actually. So all the imaging technique comes. So, but actually, biochemistry is the basic. So that is a very good field. And together with if you uh, learn this, how that. Huge data of the diagnosis that with the AI based or programming based you can modernize and your knowledge that will really help in your career. That is really it'll open up your area because now only after MSc biochemistry more actually towards people look for more towards the research because you don't have the other perspective of the field. But with this course, you can go in the other perspectives. Yeah.
Thank you, ma'am. I hope this answers your question, Miduna. Please post your questions in the chat. We'll take up your questions. Any career related questions, if you want to ask, you can ask us here. Meanwhile, ma'am, I would like to know since this session was all about molecular diagnostics and digital imaging, and also we got to learn about the stem cell and AI and precision medicine. I would like to know, like, where do you see the field of molecular diagnostics and digital imaging heading in the next 5 to 10 years? Like, what innovations can we expect?
Yes, so I think in a 5 to 10 years, diagnosis will get complete automatic. Yeah. Otherwise, healthcare industry cannot survive. Uh, and even in India's rural area of India, they have to take the uh, have to take the technology of AI-based diagnosis. Otherwise, we will fall behind. Abroad is already doing, and they because they are also pathologists, manpower is a huge, so they want to uh, autom- do the automation. But India is not that only the manpower. India, the number of patient is huge. So we need the pathologists together with the automations. Otherwise, it will be extremely difficult for India to handle. And it's already that all big private hospitals are already transforming their diagnosis method. Yeah. Earlier, if you give blood sample, it used to take 4 5 days or 1 week to come report. Nowadays, you will get the report in a how many hours? Yeah, in a few
Yes,
hours,
ma'am.
you will get your whole health checkup. Yeah, even the one day you will do the checkup, whole checkup. That package nowadays comes. Yeah, and in the next day you will get the whole report. So all the hospitals already started this automation. So it has to be. And in cancer diagnosis is a huge implications. Otherwise, managing data will be very difficult. That what you are telling, that when you are in the different stages of cancer diagnostics, then you have to understand that which part of the cells is bad, what. So it's a huge data from a single patient come. Uh, so and that you have to make automatic, because it's over the time it will generate single one patient actually over the time gives a sample and
Correct, correct.
same patient record you have to keep. Mm. So without that digitalizations of the data, or you say AI based data, it would be impossible. So this industry actually it will grow as per Indian predictions. 10% will increase in a last next 5 years. It's already more 1 million industry actually, and it's already changing. Uh, and industry is really facing the crisis of the manpower, skilled manpower. So, and for that reason, as Manipal Mahe education is associated with the Manipal hospitals and Kasturba Medical Hospitals, so we know actually how this industry is suffering. So we thought actually why there is no courses for this.
Correct.
So that is our biggest question. Why is still not India started these courses? All are very like a Coursera kind of courses, 1 month, 2 month. There you cannot learn everything what I told you. Yeah, because even it's a interdisciplinary, all module to understand you need little time. So for that reason, we thought to make it 1 year, and as per the requirement will change. If you later, if we see on a 6 month we can give, maybe we'll make it a 6 month course. But I think a 1 year is for bioscience people need this course.
Yeah.
Yeah. So we made a diploma. We haven't made it MS.
So, please note everyone, there is a lot of scope in this field, and if you are interested, so go through it, go through the module, and you have all be you are familiar with what are the career opportunities we have in this field. So now you all are familiar with this molecular diagnostics and digital imaging. Don't forget, it's the future. And if you want to make a career in field of healthcare, this is for you. Now we have a question, one more question we have. So question is from Das. So the question is that can you please suggest me any diploma course on clinical research? So ma'am, is there any diploma course on clinical research as well?
In clinical research diploma course, actually, Mahe gives lot of courses. I would suggest you just search in the Mahe courses. There could be. I'm not very sure. Yeah, but Mahe gives lot of courses, especially in the Mahe Manipal campus. I think KMC, Kasturba Medical College, could have this kind of course. You please search that. Mm.
Okay, thank you, ma'am. So Das, please search as ma'am mentioned. I hope this answers your question. Hello, Monica. If you have any question, please post in chat. We'll take up your question. So we are coming to the end of the session. Quickly, we can take one more question. If anybody is having any question, please post. We'll take one more question. Last question we'll take. Okay, so if no more questions, then
Yeah.
ma'am, would you like to add something? Like if we don't have any more questions now, so if you would like to like any message for our attendees, our participants, any message would
Yes.
you would like to give?
So, what we have observed after BSc and MScs, many are very confused and uh, losing years sitting at home, just thinking what they will do. Yeah, for them, I will just tell that learn this course, and this will really open up big big picture in the healthcare and big areas where you can fly, I think, in your career. So this is my message to the students. Instead of sitting and thinking what next we'll do, there are many students I know, they're very confused after MSCs actually, and many have a tendency just applying abroad for some kind of PhDs and some kind of jobs. Yeah. So for them, we are telling people only just applying, sitting without your knowledge. You'll sometimes, yes, some really gets, but some may stuck actually and lose the years. For them, better actually to come this kind of new areas and learn, which is actually coming era. We all know actually AI is the coming era, and we have to make the automations and things with the core knowledge of your bioscience, your biotechnology. You you spend 1 year, it's not a much time, and it's a huge learning. So that is my last message.
Thank you so much, ma'am. We have actually a lot of questions, but because we have a limited time, like even we have some questions in the chat also, but because of the time constraint, we cannot take up more questions. But I really thank you and really appreciate your willingness to answer questions and engage in meaningful discussions, fostering an interactive and dynamic learning environment. And thank you once again. We are immensely grateful for your time, dedication, and expertise. So thank
Yeah,
you so much. Thank you
thanks a
so
lot
much.
for your insightful questions. Yeah, I really enjoyed. Yeah, uh, thanks a lot. Yeah,
Thank you, ma'am. And
thank
even
you.
I would like to thank all our attendees for your
Mm.
active participation for today's session. And I would like to mention that don't get disheartened if your questions has not been answered. You can always mail it to Shekhar sir ID, that is shekhar@biotechnica.org. You can post your questions there, and we'll try to answer them as soon as possible. So thank you everyone for your time.
Thank
Thank you
you,
so much,
everyone.
ma'am.
Thank you for Biotechnica for your great time. Yeah, and your real interest and your insightful questions. Yeah, thanks a lot. Yeah, yeah,
Thank you, ma'am. Thank you, everyone. So, with
yeah.
this, we end the session. Take care, everyone. Soon we'll come up with some more sessions, such insightful sessions. So, don't forget to attend these sessions, and I'm sure it will going to definitely help you, and you will be learning some more. You will be learning about more career opportunities and the fields. So, definitely, it will going to help you. So, thank you, everyone. Take care.